All right. Hello, everyone. My name is Debbie Kaltman. I'm here with Betsy Cahill from the Healthcare and Science Career Community. And we are here with DePaul alum Karen Mancera-Cuevas to talk about her career journey and important current role at the Illinois Department of Public Health. So thank you so much for taking the time to talk with us today.
Thank you.
So to kick things off, Karen, we were wondering if you could explain to us a little bit about what your job is and what you do on a daily and weekly basis.
So I am at the Illinois Department of Public Health Deputy Director of the Office of Health Promotion. So the Office of Health Promotion covers anything from chronic disease related issues in diabetes, cancer, cardiovascular, violence prevention, opioid use, dementia, rape prevention, asthma is another topic that we cover as well, tobacco control, vaping. That is all within chronic disease alone, and that doesn't include newborn screening follow-up. Also, we cover all oral health guidance, and the Office of Oral Health is based out of the office that I lead. And then in addition to that, we also have the medical cannabis unit that serves throughout the state of Illinois. And most recently, we created a division entitled the Division of Emerging Health Issues, which is looking at epidemiological outcomes within, chronic disease states, and specifically within target areas that covers cannabis, vaping statistics, the impact of opioid use within the public health lens. And also, we are looking at the impact of violence prevention and suicidality.
Thank you. Definitely a really interesting mix of topics. Can you tell us a little bit, Karen, about sort of what some of your work looks like? So what maybe a typical day or week in your role looks like?
Typical days are actually very busy. I mean, I'm usually in meetings with division chiefs. Within all of those units, there are division chiefs looking at the progress of their programs. I'm having meetings sometimes with government stakeholders, constituents throughout the state of Illinois that may have intersection with our office. I also might be having conversations with fellow offices. Also, I belong to associations. So I belong to American Public Health Association. I'm governing counselor. So there's a lot of professional associations, public health activities that I need to do. I'm also editor-in-chief of associate editor of a journal. So I work with the editor-in-chief on that. And so we have regular meetings. I'm also in between meetings doing manuscript reviews for public health manuscripts. And also, engaging with sometimes challenging issues that might be emerging within the office. But also, we might be looking into, what do we want to do with, our current infrastructure. So let's say we wanted to do an analysis of, oral health data in the state of Illinois. We had to partner with another office in order to do that. And that's for our purpose, kind of layering, for informational purposes, what it is that we are gaining with our current traction of grant related outcomes that's not necessarily derived on any given basis. So if you're doing the job, sometimes it is hard to see, the statistics and the numbers and how that looks in terms of statewide yield. So in between all of that, that's what we try and look into more longitudinal projects.
Wow, thank you for sharing that. And can you take us back a little bit and tell us more about your career journey and how you came to this job at the Illinois Department of Public Health?
Well, my career journey is very lengthy. I mean, I had a bachelor's in community health education, and I started, as a health educator at the Epilepsy Foundation. And from there, I moved to the University of Illinois, Chicago, to do, research in obstetrics and gynecology. I was there for a couple of years. Then I went on to Northwestern, where I spent the biggest gamut of my career in between the Department of Preventive Medicine and rheumatology. Preventive medicine really looked more at, our atherosclerotic type of longitudinal studies that were multi-ethnic, oftentimes funded by the NIH. And a division of rheumatology offered more the experience of, going through the journey of clinical trial research, community-based participatory research. Along the way, I think that, I think it's important for students to understand that it's not just kind of going from one job to the next job to the next job, which sometimes is a little bit, like of a disconnect. I think that there's also personal growth besides career growth, and then academic growth that has to occur at the same time. So as I was going from job to job, I was also going to school, and then going through a lot of other life events, in my life. And so I think that that's really what makes, especially the more integrated professionals, much more intact. I think that it's not just, like being that person that 40 under 40. I think that it's really being able to not only be respected in your field, but really going through life events so that if you supervise, you can understand your staff. So like if your staff are going through a challenging life moment, you have also been challenged personally to be able to properly empathize as a supervisor instead of kind of doing things by the book. That's really what has gotten me to where I've been at. Here and there, I've had mentors, but other times in my career, other times it's just been, I can say it's been self-taught, and other times, coincidentally, I have run into people in my career that have kind of said, we think that it's a good time for you to start pivoting and start considering that and how you would kind of lay the framework for that type of thing. So, so that's, like kind of how I would say that I ended with the way that I ended up there wasn't a direct pathway. Now I knew from day one that I was going to do public health. That was not anything that was ever in my doubt that I would ever do. But when I started my career, in the late 90s till today, I would have never imagined I would have gotten to this point, because I was always thinking I'm going to be at the community, or I'm going to always be there. And that was kind of my construct at the time, so sometimes early in your career, you have an idea, and then later on you're like, well, that was great then, but maybe I want to, push myself a little bit further later on. So as I would say, I think that everyone is going to have a different journey and different pathway, and there's no one way of getting to any one place. And, like the concept of what it is to get to the top is also very individual. For some people, working grassroots, that is the top, and that, fulfills meaning in their career. And for other people, they want to weave into other layers and other specialty areas in order to expand their horizons in their career. So that's what I would kind of say, is that it's not very prescribed. I can't say I spoke to this person in order to speak to this person, and that's how I got over here. It's some of it was I was at the right place at the right time. Some of it was I had certain mentors. Some of it was I personally grew to the point that I wanted to move in a different direction. And some of it really was that you get to a point in your career where kind of all of the prior steps that you've gotten to get there kind of make sense, because it all comes to a fold. So all of those early experiences, doing certain things, is then comes together in that final, in the current, at least in the current position from where I'm at right now.
Fantastic, thank you. I really love what you said about having empathy as a manager and as a colleague, and understanding your staff and your team as people and not just employees, and leading with empathy. I really appreciate that.
Yeah, thank you for that insight. We were wondering if you could tell us a little bit about what you find most rewarding about your current job that you're in, as well as what you find most challenging about it.
I think what I find most rewarding is that, particularly to lead the Office of Health Promotion, is that I am a health educator. And so I think this is the first time that you're seeing a health educator lead, particularly this Office of Health Promotion. So I have plenty of health educators in the office, and that's where I was at very early in my career. And it's really what I love. It's really the foundation of my career is in the office. A lot of what we do, even offshoots, even within oral health, they do parts of health education. Obviously, in chronic disease, they do health education, but the main focus of the office is health education. So you really have to be passionate about it. And it really intersects with a lot of my professional interests, which is health education. I belong to health education committees, health education organizations. So it kind of reinforces that. I think that maybe, what has been like the most challenging, if I could say what would be the most challenging, has been, I think, just generally for that pivoting towards the post-COVID. And really, there's been a lot of individuals in our office who are accustomed on that one-on-one interaction, and having these in-person meetings and really having to reassess what is the best way of communicating. And we try to limit those in-person interactions as much as we can, but sometimes I think that a lot of that, even I sense with individuals within the office, they enjoy the remote work, but I think at the same time that there is a benefit to that in-person interaction that I think has been challenging more for some individuals than others. Particularly in the workplace, especially those that work more in a team format, to properly communicate. Sometimes communication can be lost by email or by text. And so, I think as with many workplaces, we're, trying to, continue to even out those edges.
Definitely. Yeah, that makes total sense. Um, let's see. So, one of the goals of the work that Debbie and I do is to help expose students to different career paths related to the areas of health and science. And so, we were curious if you could share with us what are some of the career paths in public health that students might not know about, or some of those different avenues that might not have occurred to students where there could be opportunities.
Well, I think that there's several career paths that one could consider, within public health. A lot of times, there are the traditional organizations where individuals, might want to volunteer. But then, there's others where they want to maybe look at other, types of, work environments to see if those are, other alternatives. And I think that the problem with public health is that one thinks public health is just going to be couched in either governmental or nonprofit. And maybe sometimes you'll see academic public health, but not to the greatest extent in terms of workforce. But there's also other places where you see, public health in action, and they might be in traditional workplaces that are not public health. They might be in industry, they might be in very unconventional areas. I think that the biggest challenge for a student in public health, and I can even say for myself, is just really the lack of opportunities, and that there's more people with degrees in public health than jobs for people in public health. And so sometimes it's almost like you have to pivot your way around greater in this field than maybe in other fields. Like if you were an accountant, then you would find a job in accounting, and it's much more cut and dry. Versus in public health, sometimes you need to weave sometimes a little bit on social service. sometimes a little bit in academia, like sometimes you start doing things that are philanthropic, not truly public health, it might be social justice. And so you're trying to really find your niche. And in a lot of ways, it's more challenging for a public health student to find a place because it's just, like there's not enough out there. So, so I tell sometimes people, besides volunteering, maybe you should talk to people, and then you should, I think that there's value in mentorship. But I individually, I have actually several people contact me each week on LinkedIn about advice in public health. And I said, mentorship I think is very important, but I think mentorship also is something you need to go on with your eyes wide open, because you have some mentors that have their agenda and they don't have your best interest in mind. And so you really have to weave that very carefully, because that I think is a tightrope, to go through. And you kind of have to say, okay, is this in my best interest of myself and my career at this point? Or is it something that my mentor would like me to do because it benefits them, but doesn't benefit my public health career? So you kind of need to, take both things with your eyes wide open and kind of assess what's going on, and really be mindful of those types of strategic decisions.
So you mentioned service work and social justice. How do the kind of DePaul's Vincentian values and social justice inform your work in public health?
So it does a lot, because of the fact that, I'm sorry, my dog is barking in the background, but you consider about, individuals who do not have appropriate access to care. You think about, current issues like Black Lives Matters and the social justice movement. You think about racial ethnic inequities, you think about gender specific inequities, and you really have to tailor your programs accordingly in order to fulfill, what we've created internally within the agency are, racial and equity checklists to make sure that, grantees are really cognizant of those types of things when you're developing programs, when you're implementing them, when you're working with stakeholders and the such. So I think that those are really integral with, program development.
Well, thank you so much for taking the time out of your very busy day to talk to us and to share your advice with DePaul students. We really appreciate it, and we really appreciate your insights, and we look forward to sharing them with students. So thank you so much.